Hi, I'm Dr. Grady Goodwin, Medical Director of the clinic at CC Young, and I'd like to visit with you for a few minutes about the coronavirus pandemic and CC Young's response to it. I'm sure you've gathered this from watching the news, but what we're now facing with the spread of this disease is the most serious health crisis this country has faced in over 100 years. When you combine the characteristics of the virus itself and pair those with our general lack of preparedness, you really get a perfect storm of circumstances that has led to this problem. As you know, this disease is caused by a virus similar to those that cause influenza or the common cold. But the problem we face with coronavirus is far more dangerous than the flu or run-of-the-mill cold for several important reasons that I'd like to discuss with you. First, the incubation period for coronavirus is longer than that of the flu or cold virus. So what does that mean? Well, the incubation period is the time it takes for a person to develop symptoms after they've been exposed to an infection. For the flu, people, on average, develop symptoms within 2 days of being exposed. For coronavirus, the average is 5 days, but it can be up to 14 days. So folks who get coronavirus may not even know they have it for up to 14 days, and in that time may unknowingly transmit it to others. Second difference, coronavirus is more contagious than the flu. We still don't have all the data, but it appears to be at least 2 to 3 times easier to transmit coronavirus than flu. And third, mortality rates for coronavirus are higher than they are for the flu. Again, we don't have all the data, but estimates suggest that coronavirus may be 4 times as deadly, possibly even worse. What is clear, though, is that the elderly and those with chronic illnesses, especially cardiopulmonary disease or illnesses that compromise immunity, have a significantly higher rate of severe illness and death. So what we have is an infection that is very easy to transmit and is especially dangerous for seniors and those with chronic illness. That may sound like a familiar bunch to you, which is why there's so much concern about folks who live in senior communities such as CC Young. What makes all this even worse is that because coronavirus is new, very few humans have been exposed to it, so there's no natural immunity. And unlike the flu, there is no vaccine for coronavirus or any specific medications to treat it, though several are being studied as we speak. So the best strategy for managing this focuses on preventing the spread. Now, that sounds easy, but it's complicated because the U.S. was caught unprepared in terms of protective equipment and, more importantly, testing. We still don't have the ability to test everyone with symptoms, and this time of year, the symptoms of coronavirus, which include fever, cough, tiredness, are very common. As you know, this virus is spread through saliva, nasal secretions, and respiratory droplets expelled when folks cough or sneeze. It can live on inanimate objects or other surfaces for up to several days, depending on the circumstances. So hand washing, avoiding high-touch surfaces, and being cautious around those coughing or sneezing remain very important. But in terms of prevention, our best weapon by far is social distancing and quarantining those with new symptoms or possible exposure. We have the benefit of hindsight in looking at what's happened in other parts of the world. Coronavirus has been disastrous for countries like China, Italy, and Spain, and they've really only been able to slow the spread with quarantines and curfews. The U.S. has now followed suit, and our state and local governments have been especially proactive with shelter-in-place mandates that I fully support. CC Young's campus policies, in particular those barring visitors and those requiring quarantine for folks with symptoms or who have left campus, have been put in place for exactly the same reason. It's simply the best and most impactful measure we have in keeping residents safe. I believe those policies are in line with government guidelines, and they've been made in consultation with the campus's medical staff. So, could we be less restrictive in these policies? Sure. The government has mandated the vast majority of CC Young's precautions, but I'll bet there are some communities with fewer restrictions. A good example might be the quarantining of those who leave campus. Some facilities probably don't have that. But I remain convinced that this is something that reduces the risk of introducing infection to the campus. Is it inconvenient? Absolutely. But it's the type of proactive thinking that I believe to be prudent. And I can tell you that the leadership at CC Young has really wrestled with these decisions. They're not popular, and they're very difficult to make with currently available data, which is imperfect at best. but I fully support the precautions your campus is taking and pray that each of you will take them seriously. Employees in particular need to be cautious as we're the group most exposed to the surrounding communities. It's also hard to expect residents to abide by rules when we're not following them ourselves. We can all do better on this, myself included, and do a better job towards preventing the spread of this disease. And while it may be painful or even overly aggressive in retrospect, the consequences of falling short here are simply too great. Now, it's likely that a large number of Americans will become infected with this illness regardless of how careful we are. But even if our precautions just delay the spread, it's still worth making the effort. Most experts agree that we don't have enough hospital beds or critical care resources to handle a surge of coronavirus cases. That's what you've likely heard on the news described as flattening the curve. In short, the longer we keep coronavirus off the CC Young campus, the better. So please continue to do your best in terms of social distancing, hygiene, and letting someone know if you develop new symptoms. Again, this is completely uncharted water for everyone. Information on how best to manage this illness and protect those among us who are most at risk is changing daily. The country as a whole is struggling with this, and our little corner of it is no different. Things may get worse before they get better, but I believe we live in the best country on the planet, and I'm confident that the next couple months will prove that. And having worked in a number of senior living communities, I can tell you that you could not be in better hands. Things at CC Young are not perfect, but the folks in charge are not afraid to make the tough call, and in my view, they've continued to do what's best for this campus, even when it's not popular. I really think that's what you want. I've also never seen a community where the residents and staff care about one another as deeply as you do here at CC Young. So even if you're not worried about yourself, please continue to work on prevention for the sake of your neighbors. I'm convinced that together we'll get through this. I appreciate you listening. Hope to see you around campus soon. Stay safe.